Next up is agencies may step up enforcement of the contraceptive mandate. If you've been keeping up with me, you know that I have been really paranoid about this Roe v. Wade being overturned because it was a federal law before and it applied to all health plans, and now it's being applied to each state. And because I work with employers and employees in all states, I want to make sure that we have all of our ducks in a row and are following all of the legislation. So want to make sure that nobody is getting in trouble, because we don't know. We don't know if an employer can, or a health plan can get in trouble criminally or civilly if they are paying for an abortion somewhere where it is illegal, or flying them outside of a state where it is illegal into a state that is legal. It doesn't seem like there's going to be any cases brought forward, but what if they are? So anyway, it just makes me a little bit nervous. And I did another video on Roe v. Wade. It's actually at the end of my last compliance video, which I will link here. I saved it till the end. I went over ACA, and then I went over the Roe v. Wade and some of my concerns about that. And some of the ways that I think people can just take a more cautious stance with all this and hopefully stay out of it. So the U.S. Department of Health and Human Services, the Department of Labor, and the Department of Treasury, these three agencies that regulate healthcare coverage, have issued new guidance to clarify protections for birth control coverage after ACA. The guidance follows a recent warning that agencies could set up enforcement of ACA contraceptive mandate in light of complaints about employer plans that aren't providing adequate coverage. So I have heard just word on the street stuff, nothing in any studies, but just in talking to people, I hear a lot of fear surrounding the contraceptive argument since Roe v. Wade was overturned. In my eyes, it's two totally different issues. We should have the right to put whatever we want into our bodies, regardless. I mean, I even think that, certain, all drugs should be legalized, but that's beside the point. The guidance was proposed on July 28th as a set of frequently asked questions, and announcing it, Labor Secretary Marty Walsh said that the guidance makes clear that the law requires group health plans and health insurers to provide contraceptive coverage, including emergency contraception, at no cost to the participants. If the plan and the issuers are not complying with the law, we will take enforcement action to ensure that participants receive this coverage, again with no cost sharing. So this is where I get really confused, and it is because on one sense, ACA is this federal law that is supposed to oversee all of state law, which is against what we are supposed to be doing historically, which is follow state law unless you're governed by ERISA. So if you are fully insured, your plan is supposed to follow all state laws. Okay? But if you are self-insured, if you're paying out your own claims, you're supposed to be governed by ERISA, which is more of a federal legislation. So just looking at those two buckets, you would think that, ACA would just be applicable to the ERISA people. No, that's not the case. I mean, when ACA came out, they made it applicable to all health plans in all states, which is quite confusing. So there's situations like in the case of Roe v. Wade where the government dismantling that on a federal basis and throwing it back on the states makes it a state issue. That one little piece of coverage is now a state issue. And then we've got this overreaching ACA guidelines that are dictating to the states what they have to do about contraceptives. So it's really bizarre how the logic is congruent in one and then it's opposite in the other. Guidance comes after a June 27th letter to group health plans and health insurers in which Walsh HHS Secretary Xavier Becerra and Treasury Secretary Janet L. Yellen noted that plans and insurers are required to cover at no cost at least one form of contraception within each contraceptive category identified by the U.S. Drug Administration, the FDA. Specifically, plans and insurers are required to have an easily accessible, transparent, and sufficiently expedited exceptions process in place that ensures individual can receive coverage without cost sharing for the FDA approved, cleared, or granted contraceptives products that is medically appropriate for them. The facts guidance further spells out that the ACA guarantees coverage for women's preventative services, including but not limited to hormonal methods such as birth control pills, implanted devices such as IUDs, emergency contraception such as Plan B, barrier methods such as diaphragms and sponges, patient education and counseling, sterilization procedures, any additional contraceptives approved, granted, and cleared by the FDA. So they are really making sure that a lot of the people, employees and employers that I've spoken with alike, there's rumors going around that these states are going to outlaw birth control now that Roe v. Wade has been overturned. And I don't see that being the case, specifically with these three agencies getting involved. I really don't see it being an issue in the foreseeable future. I don't pretend to know what the future holds. It seems to be changing quite erratically nowadays. I really don't see any state plan, any fully insured plans having to get rid of their contraceptive coverage. As far as I know, all of them are still covering it at 100%. It's considered, protected by the ACA, and that's that. So I think we're good there. I've been keeping an eye on this and waiting to see exactly how this is going to be interpreted. I mean, again, because I'm not an attorney. This is not legal advice. I talk to attorneys, but I am not an attorney. So this is an opinion piece from an article and some information of what I've gathered in working in health insurance plans for over 20 years. It seems that, yes, there's a lot of complications with Roe v. Wade being overturned and some confusion with health plans and confusion with travel benefits and what's covered, what's not covered. Are people going to be liable in some way if they're paying for these benefits? Abortion is a totally different subject than birth control. It's a different category. So as far as I know, there still is contraceptive coverage. The states are not outlawing birth control. IUDs are still available. Hormonal birth control is still available on all ACA compliant plans. Now, if you are on a fully self-insured plan, there are different regulations there and is a different topic altogether. But I'm talking about ACA compliant plans, which most people are going to be on. So with that, I'm going to wrap it up. Hopefully this helps you and it's as clear as mud. Today's date is August 11, 2022, so this could change. And it is something that we're keeping an eye on. If you are a client and you have a question, I have a link down below to schedule an appointment with me if you want to talk about it. If you're not a client, we can still talk about it, but you do have to complete a questionnaire before hopping on the phone with me. Again, thank you for hanging out with me, and we'll see you next time.